With hypomagnesemia, hypo means lower and magnes refers to magnesium, and emia refers to the blood. So hypermagnesemia means lower than normal magnesium levels in the blood, and symptoms typically develop at levels below 1 mil equivalent per liter. An average adult has about 25 grams of magnesium in their body. About half is stored in the bones, and most of the other half is found within cells. In fact, magnesium is a really common positively charged ion found within the cell, second only to potassium. A very tiny fraction, roughly 1% of the total magnesium in the body, is in the extracellular space, which includes both the intravascular space, the blood vessels and lymphatic vessels, and the interstitial space, the space between cells. About 20% of the magnesium in the extracellular space, which would be about 0.2% of total magnesium, is bound to negatively charged proteins like albumin, but the other 80% or 0.8% of total magnesium can be filtered into the kidneys. So inside the kidney, that magnesium gets filtered into the nephron, and about 30% gets reabsorbed at the proximal convoluted tubule, 60% gets reabsorbed in the ascending loop of Henle, and 5% gets reabsorbed at the distal convoluted tubule. And that leaves only about 5% to get excreted in the urine. Magnesium levels can fall in a few situations. One scenario is when the nephron fails to reabsorb the magnesium that's filtered out of the blood, which would mean more gets excreted in the urine instead of kept in the blood. Magnesium reabsorption is mostly a passive process, where the positively charged magnesium ion follows the electrochemical gradient and moves from the positively charged lumen into the cells lining the lumen, which usually have a negative charge. Now, loop and thiazide diuretics can disrupt this process, because they both make the lumen less positively charged, and this diminishes magnesium's electrochemical gradient and causes more of the ions to stick around in the filtrate and get peed out. Another sort of similar scenario is a genetic mutation that affects the channels that regulate ion flow, which again could change the electrochemical gradient and cause more magnesium to stick around in the lumen and get peed out. An example of this is Gittleman syndrome, where there's a mutation in the gene coding for the NaCl cotransporters in the distal tubule. Now, a different mechanism for hypomagnesemia is prolonged malnutrition, where not enough magnesium gets consumed. Alternatively, there might be enough consumed, but not enough absorbed in the gastrointestinal tract. So instead of going into the blood, it gets excreted. And this can happen because of interference from medications like proton pump inhibitors, or from a bout of diarrhea. Another cause of hypomagnesemia includes uncontrolled diabetes mellitus, where sometimes there can be increased levels of glucose in the blood. And this means that there's also increased glucose filtered into the kidney and nephron, which ends up attracting a lot of water and causes a large volume of urine to flow through the nephrons. This high urinary flow carries ions like magnesium right through the nephron, because the fast flow doesn't allow enough time for magnesium reabsorption to happen. Yet another cause is hungry bone syndrome, which is when the thyroid or parathyroid glands are surgically removed, which leads to increased bone formation. In this case, the osteoblasts, or bone-forming cells, are literally hungry for ions to make more mineralized matrix, and so it ends up taking the magnesium from the blood. Another one is alcoholism, which offers kind of a mixed picture, because often these individuals have a poor diet, which means there might be low magnesium intake. But in addition, alcohol also increases renal excretion of magnesium. Additionally, low magnesium in the blood is commonly associated with low potassium in the blood, or hypokalemia, partly because a lot of the conditions that cause hypomagnesemia, like diarrhea and diuretic therapy, are also responsible for hypokalemia. It's also thought that normally magnesium inside cells of the nephron tends to get in the way of potassium channels a little bit. So with less magnesium, potassium is more easily secreted, excreted, and wasted, which can lead to hypokalemia. Now, severe hypomagnesemia can also lead to low calcium in the blood, or hypocalcemia, since the parathyroid gland needs magnesium in order to release parathyroid hormone, which normally causes osteoclast cells to release calcium from bones into the blood. So without this magnesium, there's impaired release of parathyroid hormone. And it's also thought that magnesium is needed in order to respond to parathyroid hormone as well. And so both of these result in less calcium in the blood. Early symptoms of hypomagnesemia, though, are often neuromuscular. This happens because, under normal circumstances, at the neuromuscular junction, there are voltage-gated calcium channels on presynaptic neurons, which need to open and let calcium in to cause the neuron to release neurotransmitter and ultimately cause muscle contraction. Magnesium seems to inhibit calcium influx a little bit, which ends up stabilizing the axon. So without magnesium floating around, calcium can enter neurons more easily, and this makes the muscles and nerves more excitable. This can end up leading to neuromuscular symptoms, like uncontrolled stimulation of nerves as well as tetany, which is a condition where there are intermittent muscle spasms throughout the body. These spasms are particularly evident in the muscles of the hand and the forearm, known as trousseau sign. When the spasms happen in the muscles of facial expression, it's called Chvostek's sign. Severe hypomagnesemia can even lead to convulsions or seizures, as well as abnormal heart rhythms. Now, diagnosis of hypomagnesemia is usually done by measuring the level of free unbound magnesium in the serum, or doing a 24-hour urine collection. Treatment here depends on the cause. So, for example, if it's due to inadequate intake, then it can be supplemented orally. In more severe cases, magnesium can be given in the form of magnesium sulfate intravenously or intramuscularly. Alright, as a quick recap. Hypomagnesemia refers to decreased free magnesium ion levels in the blood. And this can be caused by excessive excretion by the kidneys, as well as inadequate intake of magnesium. These situations can lead to symptoms once below 1 milliequivalent per liter. And these symptoms can include uncontrolled firing of the neurons, which lead to muscle spasms, or even seizures and cardiac arrhythmias. What's up, guys? Thanks for watching. I got a couple updates for you. Update number 1 is that video was marks one of the last videos in the renal playlist, like all the renal videos. We're almost done with all of them, just like cardiovascular, which is really exciting because we've been working on them for a really long time. So that's going to be awesome. So look forward to seeing the last of those in the next couple of weeks here. Second update is that the Osmosis team is going to VidCon this year, so we're just kind of hashing that out, which is really exciting and really looking forward to that because it's going to be a blast. We went last year and it was really fun. So if you're going to go to that, we'll see you there. Other than that, I'm just going to say thanks to Debal for writing the script, Rishi for editing the script, and then I did the illustration and the audio. You guys can always help support us by donating on Patreon or subscribing to our channel, as well as subscribing to all our other social media outlets like Twitter, Facebook, Instagram, and even Reddit, where we have a subreddit called r/osmosit. So go check that out, upvote some stuff, do what Redditors do. All right, guys. See you later.